What if I told you that for decades, we've basically been looking at one of our body's most vital systems with one eye closed? Well, today, we are diving into a huge shift in how we understand kidney health. We're going to explore how two simple numbers, not just one, can finally reveal the true story of your kidney's vitality. And this is all based on the latest guidelines from the world's top experts. Let's dive in.
So let me ask you a question. How healthy are your kidneys? It sounds like a simple question, right? But for the longest time, the answer has been surprisingly tricky. Your kidneys are these master filters, working silently 24/7 to keep you healthy. But how can you really know how well they're doing that job? Well, that's the very mystery we're going to unravel today.
And a huge piece of this puzzle is that chronic kidney disease, or CKD, is often totally silent in its early stages. It doesn't really have symptoms. And that means millions and millions of people can have their kidney function declining without even having a clue, which makes getting an early, accurate picture absolutely critical to stop serious problems down the road.
For years, this is what doctors and patients have been up against. You get a single lab result, and sure, it gives you a clue, but it was kind of like trying to judge a car's overall health by only looking at the speedometer. You can see how fast it's going right now, but you have no idea what's actually happening under the hood. It just wasn't the whole story. Okay, so this is where the big breakthrough happens. The experts realized we need to be looking at two key numbers together. And to make this super simple, let's stick with that car analogy. Just think of your kidneys as an engine. To really know how healthy that engine is, you need to measure two things: its power and whether or not it has any leaks.
So the first number is your glomerular filtration rate, or as you'll see it, GFR. Now, this is basically your kidney's horsepower. It is a pure measure of efficiency. It tells you exactly how many milliliters of blood your kidneys can clean every single minute. So a higher GFR means you've got a more powerful, more effective engine. And the second number, that's albuminuria. Now, if GFR is the engine's horsepower, then albuminuria is the oil leak. See, albumin is a really important protein that's supposed to stay in your blood. If it starts showing up in your urine, it means the kidney's filter itself is physically damaged. It's getting leaky. It is a direct sign of injury. So here's the bottom line, and this is so important. GFR tells you about function, how well the kidneys are working right now. Albuminuria tells you about damage, the actual physical state of the kidney. You absolutely have to have both to get the full picture. One measures the power, the other checks for leaks. All right, so with these two key numbers in hand, the KDIGO guideline introduced this simple but incredibly powerful new way to classify kidney disease. It's called CGA, and it brings a whole new level of clarity to not just the diagnosis, but more importantly, to the prognosis, what's likely to happen next. The expert panel knew that to really understand what was going on with a patient, they needed a systematic approach. So they combined these essential data points into one unified system that gives doctors a much more precise and, well, actionable picture of what's going on. Let's break down that CGA code really quick. C stands for the cause of the kidney disease, things like diabetes or high blood pressure. And then we have our two stars of the show. G for the GFR category, that's our horsepower, and A for the albuminuria category, that's our leak. And this, right here, is the real game changer. By putting these three pieces of the puzzle together, doctors can finally move beyond a generic diagnosis. They can create a truly personalized risk profile that can predict what's going to happen in the future with so much more accuracy. So how do we actually translate these numbers into a real-world prediction? Well, the guideline created this incredible visual tool, a risk map that shows you exactly what happens when you combine GFR and albuminuria. And this is it. This is that powerful risk map. I mean, honestly, think of it like a weather forecast, but for your kidney health. On one axis, you've got your engine's horsepower, your GFR. On the other axis, you've got the size of the engine's leak, your albuminuria. And where those 2 points meet on this grid, that reveals your future risk, moving from a nice, safe green to a very stormy, high-risk red. It's a fantastic visual, right? It's so simple and effective. But what does it really represent? I mean, what's the actual science behind these colors? And what are they truly telling us about a person's future? This quote from the guideline itself just nails it. It says that neither GFR nor albuminuria alone can fully capture the prognosis. Think about it. A person could have a decent GFR, pretty good horsepower, but if they have a big leak, that high albuminuria, their overall risk is much, much higher. Just looking at one number is just misleading. And you have to know, these colors are not arbitrary. They aren't just picked to look nice. They represent a huge analysis of patient data, linking specific combinations of GFR and albuminuria to what actually happened to those people. So let's look at the hard data that actually powers this map. These charts, they tell a story. They show that as GFR, that engine horsepower, goes down, the risk of serious outcomes absolutely skyrockets. I mean, just look at how steep this curve is. It's a dramatic picture of what happens as kidney function goes away. Let's put some real numbers on that, because this is where it hits home. In the green zone with a healthy GFR, the death rate is less than 1 per 100 person years. But down in that deep red zone with a very low GFR, that rate explodes to over 14. That is nearly a 20-fold increase in risk. It's just staggering.
And it's not just mortality. The risk of ending up in the hospital follows the exact same scary pattern. It goes from around 13 incidents in the green zone to over 144 in the red. This isn't just a theory, it's the stark statistical reality of what advanced kidney disease really means. So, okay, this risk map is an incredibly powerful predictor. We've established that. But its true value, the most important part, is how it turns that prediction into a clear plan of action for both doctors and for patients. Knowing a patient's specific color on this grid makes truly personalized medicine possible. Someone in the yellow zone might just need some moderate lifestyle changes, but someone in the red zone, they need urgent, intensive management and to see a specialist right away. It becomes a treatment roadmap.
And these action plans are very specific. The guideline actually links the risk levels to concrete strategies. Things like a strict limit on sodium, being really careful with all medications, making sure to get an annual flu shot to prevent other issues, and ensuring a timely referral to a specialist before things become a crisis. So, at the end of the day, the CGA classification and this risk map, they do something pretty incredible. They take two complex lab values and they transform them into this intuitive, actionable roadmap for preserving kidney function and protecting a person's overall health. It's all about clarity and control. This whole revolution in understanding kidney disease really leaves us with a bigger question, one that applies to pretty much all aspects of our health. In a world that's swimming in data, are we really seeing the whole picture, or are we accidentally risking our health by focusing on just a single number?
All right, quick reset. Blink twice, stretch your shoulders, and don't worry, your health lesson isn't over yet. We're switching gears now, but this next topic is just as important for your body. And if you care about staying healthy the smart way, make sure you're subscribed.
We spend a lot of time looking at our hands, right? But how often do we really see our nails? We paint them, we clean them, we file them. But what if they're more than just decoration? What if they're actually a personal health report, updated daily? Well, today, we're gonna learn how to read it. I bet you have. You're just going about your day and you spot a little white mark or a weird new ridge that wasn't there before. And it's so easy to just, ignore it, right? Oh, it's nothing. But what if those little changes, the ones that seem so random, are actually your body trying to get your attention? And that's really the key idea for our whole discussion. Think of your nails like the dashboard of your car. A blinking check engine light isn't the problem itself, not at all. But it's the very first signal telling you, hey, maybe it's time to look under the hood. Your nails can be that for your body. So let's start with some of the most visible signals, when the whole shape of your nail actually starts to change. We're gonna look at two conditions that are, believe it or not, polar opposites. Okay, so on one hand, you have something called clubbing. This is where the fingertip gets kind of bulbous and the nail curves way down. And then on the complete flip side, you have koilonychia, or what most people call spoon nails, where the nail dips inward, forming a little concave scoop. They look completely different, and as you're about to see, they point to very different things going on inside. What's really fascinating about clubbing is how specific the medical definition is. It isn't just a curved nail. The key sign is that the soft tissue of the fingertip itself swells up. And the big diagnostic clue is the loss of what's called the Lovibond angle. You can actually check this yourself. Try putting the nails of your two index fingers together. You should see a tiny diamond-shaped gap. With clubbing, that gap completely disappears. Now, this is so important because clubbing is almost always a sign of a systemic issue, something affecting your whole body.
It's very strongly linked to some serious conditions, especially with the lungs and the heart. The nail change itself doesn't hurt, but think of it as a major red flag. It's a powerful signal that definitely warrants a conversation with your doctor.
So why does this even happen? Well, the leading theory involves something called vascular endothelial growth factor, or VEG. Think of these like little construction workers for your blood vessels. Normally, your lungs filter them out, but if something is wrong with the lungs or heart, these growth factors can slip past and cruise through your bloodstream. They end up at the farthest points of your circulation, your fingertips, where they basically start building new tissue, causing that signature swelling. Okay, now let's talk about the opposite, spoon nails. The most common culprit here, the one everyone thinks of first, is chronic iron deficiency anemia. But it's definitely not the whole story. Spoon nails can also be a clue for things like thyroid problems, inflammatory issues like psoriasis, or even exposure to things like petroleum products in certain occupations. It's a sign with a surprisingly wide range of possible explanations. All right, moving on from shape, let's talk about color. And I'm not talking about a little white spot from bumping your nail. We're talking about when the nail bed itself, the skin underneath the nail, loses its healthy pink color and turns white. Now, that's the classic medical description of a condition called Terry's nails. It's pretty technical, right? A ground glass opacification. All that really means is a milky, hazy whiteness that covers almost the entire nail. It's so opaque that you can't even see the little white moon at the base of your nail anymore. The only color left is a tiny pink or brownish band right at the very tip. And this particular sign has an incredibly strong link to one major health issue. When Dr. Richard Terry first described this phenomenon back in 1954, his research was stunning. He found that 82 out of 100 patients he was studying with liver cirrhosis had these exact white nails. 82%. That is a massive correlation you just can't ignore. So, over the decades, Terry's nails have been linked to what doctors sometimes call the big three: liver cirrhosis, chronic kidney failure, and congestive heart failure. The theory is that in these conditions, there's a change in the nail bed, fewer blood vessels, and more connective tissue, which hides that healthy pink glow. Now, it is crucial to say that it can sometimes show up with diabetes or even just as part of the normal aging process. So again, it's a signal, not a diagnosis. All right, let's get to the ones that probably most of you have noticed on your own nails at some point: lines and ridges. This is super common, but what's not common knowledge is that the direction of the line, well, it changes everything. And here is the absolute key difference. You've got vertical ridges, the ones that run up and down from your cuticle to the tip. And then you have horizontal ridges, called Bowes lines, that go across the nail side to side. They might both be ridges, but what they signify about your health are worlds apart. So let's talk about vertical ridges first, because this is important. Most of the time, they are completely harmless. The absolute best way to think about them is as wrinkles on your nails. Seriously, as we get older, the little factory that makes the nail doesn't operate quite as perfectly as it used to, and these little grooves can form. They're a totally normal sign of aging. Horizontal ridges, on the other hand, that's a whole different story. A Bowes line is like a little entry in a diary. It's a physical marker of a specific time when your body went through something really stressful, like a serious illness, a high fever, surgery, or even a major emotional shock. Your body, being incredibly smart, decided to divert energy away from non-essential things, like making nails, to deal with the crisis. The nail literally stops growing for a bit, creating that indentation which you then see as it grows out. So we've covered some pretty big signals, from the shape of the nail changing to the color to the texture. But knowing all this is one thing. The real question is, what are you supposed to do if you actually notice one of these on your own nails? And this is where we come right back to our main idea. Remember the dashboard? Seeing that check engine light doesn't mean you panic and assume the engine is destroyed. It means it's time to take it to a professional to get it checked out. It's the exact same principle here. A nail sign is a prompt to have a conversation, not a reason to jump to a conclusion. So here's a very simple, responsible game plan. Number 1, just observe. No panic. Just notice the details. Is it on one nail or all of them? Step 2, think about context. If you see a horizontal line, can you remember being sick or incredibly stressed a few months back? And step 3, the most important one, talk to a healthcare professional. Share what you've noticed. They're the ones who can take that clue and see if and how it fits into your bigger health picture. You know, when it comes down to it, this isn't just about your nails. It's about learning to listen to your body. It's about developing an awareness of the hundreds of subtle signals it's sending you every single day. It's about becoming a proactive partner in your own health.
So now that you know how to read this little part of the dashboard, what other signals are you ready to start noticing?
All right, quick reset. Blink twice, stretch your shoulders, and don't worry, your health lesson isn't over yet. We're switching gears now, but this next topic is just as important for your body. And if you care about staying healthy the smart way, make sure you're subscribed.
Have you ever noticed one of those little, tiny, kind of harmless-looking blemishes on your skin? You know, maybe on your neck or under your arm? Yeah, most of us just brush them off as, I don't know, part of getting older. But what if some of these marks are way more than just cosmetic? What if they're actually a message, a sign from deep inside your body trying to get your attention?
So let's just dive right into the heart of it. The big question is this: is a simple skin tag really just skin deep? We see them all the time, right? But we almost never stop to ask what they might actually mean. And that's the mystery we're going to unravel today. Because, for a growing number of people, the answer to that question is a really clear no. That little tag isn't just some random thing. It's often a visible signpost, an external clue to a much deeper metabolic story that's happening on the inside. Your skin, it's kind of acting like a window.
Okay, first things first, let's be super clear on what we're talking about. A skin tag, or its technical name, acrocordon, is just a soft, totally benign growth of skin. And they are incredibly common. I mean, studies show up to 60% of us will get at least one. They're harmless on their own, which is exactly why we tend to just ignore them. But the fact that they're so common is what makes the pattern behind them so fascinating.
All right, so let's start decoding that message your skin is sending. The key to this whole story, the actual link between that little tag and what's going on inside, well, it all boils down to one incredibly powerful hormone, insulin. And this is where things get really interesting.
So to really get the connection, we first have to understand something called insulin resistance. Now, put simply, it's when your body's cells start to ignore insulin's signal to pull sugar out of your blood. And this is a big deal that goes way beyond your skin. It's a critical metabolic state that's a well-known first step towards more serious conditions like type 2 diabetes and heart disease.
Now, your body is pretty smart. When it senses its cells aren't listening, the pancreas basically panics and starts to shout louder. How? It just pumps out more and more insulin to force the message through. This state, where you have chronically high levels of insulin in your blood, that's called hyperinsulinemia. And this is the trigger for what we end up seeing on the skin. And this right here, this chart just lays the connection out perfectly. This is data from a study of non-diabetic patients. Now watch what happens. As the grade of obesity goes up, the average insulin level just skyrockets. And look what follows right along with it. The median number of skin tags literally explodes, from just 3 to 30. That is absolutely not a coincidence. It is a direct, measurable correlation.
And you know what? It's not an isolated thing either. A lot of the time, skin tags show up with another, even stronger marker of high insulin, something called acanthosis nigricans. These are those dark, almost velvety-looking patches you might see in the folds of the neck or in the armpits. When you see these two things together, it's a really powerful signal of the exact same underlying metabolic issue.
Okay, so we've nailed down the correlation. But how? How does high insulin actually cause these changes on our skin? Let's get into the biological nuts and bolts to see how this all works on a cellular level.
Okay, what's really cool is this analogy. High insulin in your blood flips a switch on something called insulin-like growth factor 1, or IGF-1. The best way to think of IGF-1 is like a potent growth fertilizer for your skin cells. It basically screams at them to multiply and to do it fast. And all that uncontrolled rapid cell growth is literally what creates the physical skin tag.
But it's not just about growth. High blood sugar also ages your skin through a nasty process called glycation. You can see the steps here. When you eat those high glycemic foods, all that extra sugar floating around in your bloodstream starts to latch on to important proteins, specifically the collagen and elastin that give your skin its bounce and structure. This creates these really damaging compounds called, fittingly, AGs.
Honestly, the best way to picture what's happening here is to think of it as a slow internal caramelization process. Seriously, just like sugar browns and gets stiff and brittle in a hot pan, glycation makes your skin's support structure rigid and inflexible, and that directly speeds up the formation of wrinkles and saggy skin. So if the problem is metabolic, right, if it's rooted in diet and insulin, does that mean the solution could be too? Oh, absolutely. Let's talk about how we can potentially rewrite this whole code just by changing what we eat. So one really powerful tool that can address this is the ketogenic diet.
By dramatically cutting carbs, you basically force your body to switch its main fuel source from sugar over to fat. This big shift can fundamentally change your whole metabolic environment by lowering the demand for insulin. Now, it's just one approach, of course, along with other strategies like simply cutting out refined sugar or exercising more, but they're all aimed at the same goal: improving your insulin sensitivity.
The potential upsides of a low-carb approach for your skin are actually pretty widespread. I mean, as this slide lays out, it hits the root cause by improving insulin sensitivity and lowering insulin levels. But beyond that, research is showing it can also calm down systemic inflammation, fight off oxidative stress, and even positively impact your gut health, which it turns out has a direct line of communication to your skin.
And look, this isn't just theory in a textbook. This quote from a real person, this connects all that science to an actual lived experience. They changed their diet to deal with symptoms of insulin resistance, and that visible sign on their skin, that skin tag on their eyelid, it disappeared. I mean, that's a powerful story that just brings the whole mechanism to life. So here's the crucial point, the real takeaway. We need to stop thinking of these skin signs as just annoying little blemishes and start seeing them for what they really are. They're data points. Your skin is literally a dashboard for your metabolic health. It's time we learn how to read it and what to do about what it's telling us.
Now, it's really important to be precise here. Clinically, what is proven, what we know for sure, is that controlling your insulin resistance will prevent new skin tags from forming. But anecdotally, like we just saw, tons of people report that their existing skin tags actually shrink, darken, and then fall off after they make these kinds of dietary changes. It's a really promising area where personal experience seems to be a little ahead of the formal research.
If you remember just one thing from this whole explainer, please let it be this. Your skin is not just a passive covering for your body. It is an active, visible dashboard that is displaying real-time information about what is happening deep inside you.
So how do you actually put this into practice? Well, here's a super simple, actionable protocol. Once a month, just take a few minutes in good lighting to check these key areas. Look for any new tags, any new dark patches, and you know what? Snap a few photos. This isn't about vanity at all. It's about collecting data on your own health so you can track it over time.
Ultimately, these signs on your skin, they aren't the problems themselves. They are signals. They are your body's way of communicating a much deeper imbalance. So the only question left is, now that you know the language, are you listening?
Thank you for being here with me today. Remember, small choices create big changes. Keep nourishing your health with love and consistency. See you in the next Vital Elixir video.